Greetings, online students. I got to the ear last time. This section's worth 10 points, so you want to make sure you're paying close attention. First thing you're going to do is inspect the ear. And let me pull this up so you'll be able to see it here. Oops, I think I've already pulled it up. Nope. We'll just pull it up again. Here we go. Goodness. All right, the ear. We're going to inspect the external ear and the auricle and the mastoid process. And I'm going to take myself off here for just a few minutes. Because if I don't, it'll probably mess up. It usually does. All right. I know y'all think I'm scattered today. I feel like I am. All right, so we're going to inspect the external ear, the auricle, and the mastoid process. So that's what you're going to say. At this point, I'm inspecting the external ear, the auricle, and the mastoid process. I don't see any lesions. I don't see any masses. I don't see any bumps. Then I'm going to palpate. As I palpate this, I want you to tell me if you feel any tenderness, and you're going to palpate the external ear, the tragus, the mastoid process, and the auricle. So you're going to palpate all over the ear. Do you feel any tenderness? No tenderness noted to the external ear. Now I'm going to assess for auditory acuity. And you're going to do this by doing testing cranial numb number 8, which is acoustic. And I'm going to do this by doing the whisper test. So what you're going to do is get on one side of the patient and you're going to plug the other ear with your other hand. And you're going to bounce that tragus back and forth as you whisper with your mouth covered a couple of 2-syllable words like baseball. And they should be able to hear that, and you would do the same in the other ear. If they can hear, then you would say cranial numb number 8, acoustic, intact. Then you're going to do what's called the Rhine and the Weber test, and we do this with the tuning fork. The Rhine and the Weber test, the verdict's out on actually the reliability of it, but it is used still a lot as a screening test to determine the presence of hearing loss. And what you do is the Weber test is done first to assess for distinguishing between conductive hearing loss and sensory neural hearing loss. Now, the Rhine test assesses for the presence of conductive hearing loss only, but the Weber can do sensory neural and conductive. In the Weber test, you're going to strike your tuning fork, and you're going to put it in the top of the patient's forehead, and they should be able to hear the sound in both ears equally. And if they can, then that is a normal result. Now, if the sound is louder in one ear, that's indicative of conductive hearing loss in that ear, and sensory neural probably loss in the opposite ear. And then the reverse would be true for the other ear. Now, when you're getting ready to do the Rhine test, that is when you hit the tuning fork and you hold it on the patient's mastoid process, which is the bone right behind the ear, and ask the patient to state when that sound can no longer be heard. When they can no longer hear it, the tuning fork is removed and it is put to the external ear, and they can listen for the sound. They should be able to hear it twice as long as they can feel it through the bone. So air conduction should be twice as long as bone conduction, or AC should be greater than BC. If not, then again, they have some conductive hearing loss in that ear. Then you're going to inspect the internal ear. This is worth 6 points. You're going to look in the canal and identify landmarks, the umbo, the manubrium, and the short process of the malleus. The tympanic membrane, which should be pearly gray in color, and there's pictures of this in your book for you to look at. And the cone of light will be either at 5 o'clock or 7 o'clock if you're visualizing a clock, depending upon what ear that you are looking in. So let's go back here and look on this one. And if you look in here, I have a scope that we're going to look inside my ear. And as you can see, there's lots of little hairs everywhere. And you can see my eardrum is a little reddened. Ooh, cool and got a nice thing of wax. But you can see there the cone of light. And once you follow the cone of light up, you can see the umbo, the manubrium, which is that bright red vein running through it. And then the short process of the malleus is the top part there where the light is bouncing off. You can also see a lot of white in mine. It is a pearly gray color, but it looks like it's got some bubbly areas and some white areas down in there. That is called scar tissue from repeated ear infections. All right. In the other ear, you can see, again, there's some hair. Oh, I got a nice long hair in there, don't I? But you can see this one, I've had lots of ear infections. You can actually see the holes in my tympanic membrane. You can see the cone of light down there pointing up to the umbo. It always points up to your umbo. Then if you follow that pulse, you'll see the manubrium, and the short process of the malleus is this widened part over here. But again, looking at different ears, if I had acute otitis media, this would be bulging and red, and you would not be able to see these landmarks as well. So that's what you're looking at when you're trying to find all those landmarks in someone's ear. As far as the Rhine and the Weber test, if you had a tuning fork, again, you would make sure that you do the tuning fork, and you always want to hold it down here. Do not hold it up here, because if you do, that will mess up the vibration. So you always want to hold it down here. Then you take it and you strike it against there, and you put it on the top, and you say, can you feel that equally in both ears? And I can hear that both equally in both ears. If they can't, then you can move it down to the forehead and try it there before you give up. Now for the Rhine versus Weber, again, you initiate it, you put it on the mastoid process, and you say, tell me when you can no longer hear this. Now, then you will move it to the ear. I can still hear it. Now, and that's air conduction should be longer than bone conduction, and if it's not, then you've got some conductive hearing loss in the ear and need some further testing. Again, for the whisper test, you would get beside the patient, cover your mouth, and when you're covering your mouth, you would take and beat in on their tragus so that they can't hear the word you're saying, baseball, in the opposite ear, and then you would do that on both sides. If you have any questions about the ear, please let me know. Thank you.